So I'm Sharon Ness, and I'm a union representative with the UFCW Local 141. Well, we represent registered nurses, and our registered nurses work in hospitals, and most of the hospitals are self-insured. And because they're self-insured, we have problems anyway getting claims filed and other incidents when somebody gets injured. Because the self-insurance companies, since they're individually with the different hospitals, and then there's a statewide one that a lot of the hospitals belong to, but their main goal is to save money. And so a lot of times when our nurses get injured, and I think musculoskeletal injuries are our biggest injuries, necks, backs, shoulders, and slips and falls. And when a nurse gets injured, a lot of times they try to, one, blame it on the nurse, but they also try to say, well, you already had this existing. There's probably not anybody over the age of 25 that doesn't have some changes going on in their body. And but when you're lifting and twisting and pulling and pushing all day long in order to take care of patients, then the problem that happens is, yes, you have change, and we have cumulative changes. And we're very concerned with this bill, 1082, that when our nurses get injuries and they go to file a claim, that they're going to get denied because they've already had previous damage done, and that the insurance company, whoever that may be, AIG, whoever, who doesn't know anything about hospital work, is going to deny the claim. To the nurses, what we're looking at this, it's no different than when a doctor orders a test to be done, and Big Joe Blow and the insurance company decides, well, patient Smith, I'm sorry, but you don't need that test. We've determined, and they don't listen to the doctor, and the same thing is going to happen, and we're really worried about that as nurses, that this is what's going to happen and this is what's going to change. And we already have a nursing shortage, and it's predicted to be probably tenfold by 2015. And if that happens and then claims aren't getting answered, then we're in serious trouble, because then we won't even have nurses working in the hospitals.